Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
This is St. Louis on the Air on St. Louis Public Radio. I'm Emily Woodbury.
She just gave me a huge bag of condoms like I was 16 and I'm 37. And she just told me to make sure I continuously took pregnancy tests. That to me said a lot. I knew then she was afraid and she was attempting to support her clients by telling them, protect yourself.
The drug mifepristone is used in more than half of abortions nationwide and in nearly all medication abortions. It's been deemed a safe and effective way to end pregnancies since 2000, when the FDA first approved its use. However, the future of access to mifepristone now depends on the outcome of pending court cases, including a potential decision from the Supreme Court. A federal court of appeals in New Orleans is now considering the fate of the abortion pill, and attorneys expect a ruling from the judges in the coming weeks or months. In the meantime, Missouri 1st District Congresswoman Cori Bush is determined to protect future access to the drug in states where it's currently legal. And she joins me now to discuss her efforts. Representative Bush, welcome back to the show.
Thank you for having me.
So your constituents here in Missouri are currently unable to access medication abortions. Why is it important to you that mifepristone be available elsewhere?
It must be available because we're talking about health care. This is a issue about humans and their bodies and the need for medication. It's just like when you need medication for diabetes or you need medication for heart disease or for a toothache. You need medication should be accessible to each person who needs it. It is important to us to make sure that we're speaking out about this, because if we don't stop this in its tracks, what we could be looking at is a national ban on abortion, which is what we really believe that the Republicans are pushing toward.
Now, next Monday, you plan to lead a roundtable on medication abortion and the Republican efforts you mentioned to ban the procedure nationwide. What's your goal for this hearing?
Yeah, so Representative Jamie Raskin and I are hosting a hearing on mifepristone with Democrats to discuss medication abortion and the Republican efforts to ban for that national ban that ban on abortion nationwide. We'll talk about the consequences of continued attempts to restrict abortion access, and including in states where it's legal, because even in some states where it's legal, people are afraid, may be afraid to try to access medication abortion. And we, going back again to what we're looking at is a possible nationwide ban. And this is, when we look at the statistics, when more than half, we're talking about more than half of medication of abortions are medication abortions. That's a lot of people who are actually getting services, who are getting their needs met, and just by picking up their computer or their phone and making this request online. When banning medication abortion, we understand, is a racial justice issue. We're talking about, out of all the states, there are 14 states who currently have banned abortion right now, and some of them are extreme bans. They make up about 39% of the U.S. total population, but 45%, they make up 45% of the population of Black women and girls. So we're talking about a racial justice issue. We're talking about a public health issue. And so we are highlighting this for the country to see that the Democrats won't stop fighting.
So this is a hearing for the public to witness.
Absolutely. It's for the public to witness. And, we will be talking about my bill protecting access to a medication abortion, which I introduced and reintroduced with Senator Tina Smith. We wanted to make sure that people understand that you can always access medication abortion through telehealth, through certified pharmacies and mail order pharmacies. That there is no national ban on mifepristone, on the actual drug. And we want to make sure that people know that that is a drug that has been approved by the FDA for 20 years. So we want people to know that that drug is still available, and for those that need to access it.
The hearing that Representative Cori Bush is leading, the roundtable discussion, will happen Monday, July 17th at 3 p.m. Central Time. We're also joined now by the Reverend Love Holt, who serves as a community engagement manager with Pro-Choice Missouri. She will be a key witness during Monday's roundtable. Reverend Holt, welcome to St. Louis on the Air.
Thank you for having me.
Why is this an important issue to you?
This issue is important to me personally because as a member of this immediate community, as a worker in service and a doula of this immediate community, I know personally from experience and from observation by proxy to my community members that this ban, being a total ban, especially on the medication abortion, will indeed cause chaos amongst my community. The level of desperation that sets in when you find yourself in poverty, at a dead-end job, and with an unwanted pregnancy that you can't handle discreetly and safely. Maybe you're afraid of doctors and going into the clinic and you prefer a medication abortion. Maybe you found out like I did early on and did everything you could until these bans and the laws interfered with our ability to have a safe and discreet procedure at home, self-managed. So it's going to cause a lot of problems in my community directly. Lower income, marginalized communities, trans communities, people with disabilities and physical ailments, they will too also suffer from a ban like this. And we'll feel responsible, but not until it's public and it's overflowing with problems.
You mentioned you are also an abortion doula, a cultural competency consultant. And you mentioned that idea of going to the doctor can be a scary idea.
Oh, yes.
How has mifepristone's availability impacted your clients? How have you seen it kind of change the game?
Well, it happened so quickly, right? Dobbs' decision came down in June. And during that time, people were attempting to navigate their own personal abortion things. People were okay with not having an abortion doula if they could just do a telehealth visit, order the pills, take the pills at home, and feel safe. Since this decision has come down, there's all kinds of misinformation, right? Doctors are misinformed, community members, they talked about there's no contraceptives, right? All of this misinformation doesn't do anything but drive a person like me who is Black into shock. Black people have a distrust with the medical system because we've continuously been experimented on and all types of things without us knowing. And sometimes intuitively, Black people in my community believe that things are designed to make them ill and not well. So it creates this interesting dichotomy between Black people and the doctor. They trust them because they feel like they have the expertise, but at the same time, there's a slew of distrust because they don't feel like they're getting better. They may be getting worse. You hear about Tuskegee. That'll be a story that will go until the end of the earth. And we all know someone that came from that community. We all hear the stories in family time and when our uncles talk about what they did in the 60s and the 70s. So we hear about, how Black people were treated in the medical industry. And that is something that's been ingrained in us. And so here we are at a place where we're confused. And with this ban in place, there's no way for us to safely manage our own abortions. The numbers will increase with incidences of individuals who tried to take matters in their own hands and who were afraid to communicate truth to their doctor. I almost died January 20th because of this ban. I was afraid to tell the doctors that I was miscarrying. I was afraid. And I just sat there and bled out until they decided to do something about it. Because I didn't want to scare the doctor's team from dealing with me, and I didn't want to jeopardize my freedom. I have kids at home, a single mom. And I know the fear of that conversation that I should have been able to have with my doctor that could have furthermore saved my life was infringed upon because of the history with the medical field and the current laws and lawmakers in place right now.
I'm so sorry to hear about your experience, and I'm glad you're here with us today.
Me too.
So that was in January of this year, 2023. Do you feel that had that same situation happened in January 2022 when Roe v. Wade protections were still in place, you'd still have that same feeling? Would it be different?
So 2022 is still too soon for me. I think we all anticipated this. And I know through talking to other doctors in this work, they all were kind of keeping a watch eye out for the day that it happened. See, personal practices exercise the right to provide D&C, abortions, administer medication like mifepristone, misoprostol. And because a lot of women rely on those services, it wasn't something that we broadcast. You just knew that if you had a good, reliable OB, they take care of you. So by 2022, it was still very scarce. I went for my annual checkup, and it was almost like she was nervous to ask me about my sexual and reproductive health. She just gave me a huge bag of condoms like I was 16 and I'm 37. And she just told me to make sure I continuously took pregnancy tests. That to me said a lot. I knew then she was afraid, and she was attempting to support her clients by telling them, protect yourself and find out if you're pregnant as soon as possible. In that way, it will prevent issues. So 2022 is too soon. Maybe 2020, 2021, it would have been fine. But we also have to remember 2019, there was an 8-week ban. February, 8-week ban. So there has been a lot of ups and downs. And anytime you hear about abortion, that's an issue that perks everybody's ears up. So whether it's misinformation or accurate information, we've been hearing this circulate for the past 5 years. We just didn't know what it would look like.
Representative Bush, hearing the Reverend Holt's personal experience here and knowing that she'll be speaking at next Monday's roundtable, what do you hope her testimony as a witness will do? Who is the target audience for this experience? Who do you want to hear it?
Yeah, so the target audience really is everyone in this country because of all the different stories, because these are stories of humans. You know, these aren't made up. This isn't anything that's not actually happening to people. And so that's why this was important. That's why this bill was important. That's why this shadow hearing is important, because hearing, when we just think about Reverend Holt's story, being someone who does this work, like that's the thing that is that hits me the most, is we're talking about someone who is very well connected to the community, knowing where the resources are, knowing who are the doctors, knowing, so very well connected, who educates others. And Dr. Reverend Holt herself was afraid to speak up, sat there in that hospital and bled out, and so what happens to those who aren't as well connected? What happens to those that haven't been following? She just talked about all the way back to 2019. She talked about 2021. To someone who has not been following the play-by-play of the abortion laws, not only and how they've been stripping away our rights here in Missouri and across the country. So someone who hasn't been following it that easily and that just continuously, what are they experiencing? And that's why this is important. We need those who may one day need the services to hear this and understand, so that we can come against the misinformation and the disinformation, but we also need their parents. to know. We also need their spouses, their partners to know, so that they can properly help them, that they can properly advocate for them, or just so that they can be able to support. Also, we need people to understand that what we're looking at with medication abortion is, it being a racial justice issue in the way of, and not just, it can even be a class issue, but we're talking about offering this service to folks who may not have the funds to be able to travel to go and have a procedure done in a clinic. We're talking about the need, the money for childcare, money for lodging, money for the procedure, the travel. That's nearly $1,000 on average per person. And so when you can just go online and order it, even in a state like Missouri, people are, even though mifepristone, medication abortion is illegal in Missouri. Missouri people who need the services are still accessing it online and are still able to get those abortions through those medication abortions. And our bill, we have a bill, the Reproductive Health Travel Fund Act, which we just reintroduced recently. As much as we are working to try to make sure that the funding is there, it's not all there yet. And so making sure through this hearing that people understand, like, hey, when people are saying, like, what can I do? Like, this doesn't affect me, but what can I do? Well, one thing you can do is you can help to put money. You can donate to those funds to help to make sure people have access to the services they need.
Representative Bush's roundtable on medication abortion and reproductive health care will be held next Monday, July 17th at 3 p.m. Central. The Reverend Love Holt will be a key witness at that hearing. She's an abortion doula and community engagement manager with Pro-Choice Missouri. Reverend Holt, thank you so much for joining us today.
Thank you. It was a pleasure.
We need to take a quick break. We'll hear more from Missouri 1st District Congresswoman Cori Bush when we return. This is St. Louis on the Air on St. Louis Public Radio. Welcome back. I'm Emily Woodbury. With us this hour is Missouri 1st District Congresswoman Cori Bush. Before the break, we were talking about the future of medication abortion access in the U.S. Representative Bush, you've introduced 5 pieces of legislation to bolster reproductive care. What gives you hope for these proposals while serving in a House that's controlled by Republican lawmakers who are unlikely to support these efforts?
So, yes, since Roe was overturned last year, we've introduced 5 pieces of legislation because the work still has to happen. In order to get anything across, signed into law, we have to have a bill for it. And so that oftentimes takes a lot of just lobbying and a lot of conversations with other lawmakers on the federal level, but as well as state and local. It's a lot of information sessions, and we just spend a lot of time. There's a lot of work that goes into once we introduce these bills about getting folks mobilized around them. So we didn't want to wait until we have a Congress that would be where Democrats have the House and have the Senate, as well as the presidency, to get this started. We're fighting, even though right now we're talking about 14 states, we're fighting to make sure that the abortion ban that's happened in those 14 states doesn't affect the other states. Because what we're seeing is, there is a burden on the states that do not have the restrictions because they're trying to service people from all over the country. And so the Protecting Access to Medication Abortion Act, that one, we wanted to make sure that people understood that there is a discreet way. There is a way where you can get your services without having to really leave your home. But then also the Protect Sexual and Reproductive Health Act to provide those immediate and tangible federal response to make sure that we're filling the gaps in sexual and reproductive health that was taken away through the Hyde Amendment. And then Reproductive Health Travel Fund, I spoke about that earlier. That one is going to ensure that there is money available for those that need the services logistically. St. Louis City decided to take it upon themselves, which I love, immediately jumped in and as soon as Roe fell and said, hey, even though we don't have what we need from the state, we can't make sure that we're giving resources through from the state, but the city can also do something and make sure we're taking care of city residents. And so that's the same thing that we're working to make sure that we're doing. We have a bill. This bill is going to say $300 million in federal investments to ensure that people have the support that they need, the doulas, the just wraparound services. The Reproductive Health Care and Accessibility Act, we have to make sure that those who are living with disabilities have the access to reproductive care just as anyone else. And then the Abortion Justice Act, that's just, it's basically for travel coverage. And that one was introduced with my dear friend and sister in service, Representative Ayanna Presley.
So you mentioned, not wanting to wait until you have the ideal Congress to get some of this legislation through that you're pushing for. I'm curious to hear your reflection. When you assumed office in 2021, Democrats were in the majority. Now you're in the minority party in the House. Mm-hmm. How has that been so far? What has surprised you maybe most about what's changed?
Well, I will say it's different because all I know, because my first 2 years in Congress, we were governing. Now that is not happening. And so it's just really different. But I will say that all of Congress, my entire time in Congress has been just very different than what I expected and what I was told, because my third day there was an insurrection on the U.S. Capitol. And so that just changed probably what Congress was supposed to be like, or at least what I heard it would be like. But being in the minority, just the amount of chaos all the time. The Republicans in disarray. They used to say that about Democrats in disarray. Well, that's not what's happening right now. Being in a position to where, my colleagues are being censured because someone didn't like what they said, where we continue to hear such hateful rhetoric in every single committee hearing that we have to sit through. We're hearing such horrible things, and they have the last word because they're in the majority. When we can't get bills across to actually help people because of their infighting, when we can't come together to even work across the aisle to get things done because their focus is on basically, in my eyes, fighting against anything that helps the communities that need our help the most, our most marginalized communities. It's like that's where they're starting their work. I think what disappoints me is I get to hear so often about what our former president thinks, how he feels, and how those members, our colleagues, how they are pushing his agenda. This is not about our work in Congress. Our actual title is representative. We're supposed to be representing the people that elected us, the people in our districts, whether they voted for us or not. We're supposed to be representing every single one of those, not representing a former president. And so that to me is what's different this time.
Are there areas where you do see potential to work together with Republicans? Is there anything you're currently working on with the GOP that you're proud of?
Not really. There aren't really very many areas where we see eye to eye. Let me just say this: there are areas where we may have the same vote, but we have it for two different reasons. And so I think that's part of it. Like as we look towards one of the hearings that's coming up, we have a hearing with they're bringing the FBI director, Ray, to a hearing. The Republicans want to question him. Now they want to question him about things that are more related to former President Donald Trump. But when for years, not only since I've been in Congress, but even before that, so many of us have talked about, hey, let's talk to the FBI about, how their treatment of protesters or their treatment of, Black and brown communities and just even a new report came out, a new article came out about the treatment of some former local protesters here. They don't want to talk about those things. They're not bringing him to the table for that. They're wanting to bring him to the table for other reasons. So it's very hard. But I will say this: in Missouri, at least, I was able to work on Janet Elementary in St. Louis County in the Hazelwood School District. I was able to work with Senator Josh Hawley on that issue. I was able to work with Roy Blunt when he was in the Senate on quite a few things. So at least locally, sometimes within our state, sometimes we're able to work. But outside of that, it's tough right now.
As we approach 2024, another presidential election, President Biden has already announced he will run again. Are you in support of him seeking a second term?
As someone who was told that they can't run, you shouldn't run, you don't have it, I won't tell him that he can't run. I am going to support the nominee, because I do not want to see a Donald Trump presidency. I do not want to see a Republican presidency. We have to get things done. We have to have the House, the Senate, and the presidency. So I'm going to support the nominee. President Biden has done a lot of things that I did not expect him to do. So I have to applaud him for that. I am able to have conversations to let him know, what St. Louis needs, and he knows that anytime I come before him, that's the first thing that I say is St. Louis needs this. Even the vice president knows that about me. So I have a relationship with him that I did not expect. So I will say that I will go ahead and I will be there to support the nominee the way that I did the last, 2.5 years ago. But as far as right now, making a big statement about endorsing, is an endorsement necessary? I don't see an endorsement being necessary of me going out. He's the president of the United States right now. I don't see that as a need. The need that I see is making sure that we're putting forth all of these bills, putting them before him, letting him know what our work is and what we need for St. Louis. Because me endorsing anyone right now is not going to change the field at all. Cori Bush does not change that field.
And just in our final maybe 30 seconds, what's your message to St. Louis as we approach another election year?
Your vote counts. It counts, every single vote. We have to do the work to make sure that people understand what is at stake right now. They're snatching away our rights. The Supreme Court is in a position to snatch away the rights of human beings because there was a president that was put in place that made sure that he put people in the Supreme Court that would do that would strip away our rights. We're talking about affirmative action. Right now, we could have student debt relief, but we don't have it right now because of who that president put in place. So you got to show up to vote. And it's not just about the presidency, your local, your federal, your state. We need your voice because the attacks, this is just the beginning. And so remember this, somebody's going to sit in the seat. So if you don't have a voice about who does that, that person will still have a hand in what happens to you and your children's children. And remember this, your Congresswoman loves you.
Congresswoman Cori Bush, thank you so much for coming in today.
Thank you for having me.
This episode was produced and edited by Emily Woodbury, with audio engineering and podcast design by Aaron Dorr.
Additional production support by Elaine Shaw and Alex Hoyer.
Our executive producer is Alex.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
St. Louis on the Air proudly supports local artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.